So today we're going to be going over a case study from PED 2256. We have the shoulder, specifically the glenohumeral joint. So our case study involves a 22-year-old lacrosse player. She's been diagnosed with glenohumeral instability. During practice, a few times she's had subluxation of the shoulder joint, and then she's also had it a few times while working out. She also produced a positive apprehension test, which is essentially externally rotating the arm all the way back. She also was positive for a relocation test, which is essentially, if there's pain here, pushing down on the humerus and it alleviates the pain. Last thing, she has hypermobility in this joint as well. So we'll get into what kind of joint this is. It's one of three in the shoulder. It's a ball and socket joint. A lot of you probably have heard of another one in the hip, between the femur and the pelvis. So the big difference between the two is the head of the femur, it goes inside the acetabulum of the pelvis, so it's a lot more stable. It's not going to come out as easy as it will up here. If it does come out, you got a big problem. Whereas the glenohumeral joint, it's essentially just an articulation between the head of the humerus and the glenoid fossa. So it is very shallow, so it's a little more unstable. Subluxation is possible, essentially it partially dislocating, partially coming out, and then going back in. So there are three ligaments that kind of provide stability when the shoulder is static. Also, the glenoid labrum, whereas the rotator cuff muscles, which is what we're going to be talking about today, is what provides stability for dynamic exercise, so while she's playing and while she's in the gym working out. So we have the infraspinatus, the subscapulatus, the supraspinatus, and the teres minor. Those are going to be weak in this scenario since it is popping out, so we will be talking about how to strengthen those in the next few minutes. Normally we have specific sequencing when we do any sort of rehab program. We usually start with flexibility and range of motion, but since she is hypermobile, she's actually going beyond a regular range of motion, so we're going to not worry about that too much. We're going to just do strength and work our way down.
Isometric exercises are static contractions that help maintain strength. They are great for rebuilding strength. First, we're going to start with extension. So to do this, we have the athlete facing their back away from the wall with their arms close to their side. They're going to press palms facing the wall and extend backwards, pushing into the wall. The next exercise is flexion. So the client faces the wall. She has her palms facing the wall, and she pushes forward against the wall, holding this for 3 to 8 seconds. The next exercise is adduction. This means that we're bringing the arm towards the body. So we're going to use this pull here. The client maintains a nice strong elbow, and she pulls towards her body and holds this for 3 to 8 seconds. The next is adduction. So she goes on the other side of the pull, maintaining a nice straight wrist again. She's going to push outwards, hold that for 3 to 8 seconds. The next exercise is external rotation. So Jordan just places her arm right here, and she's going to maintain a nice strong elbow in this one as well, making sure it's not coming off of the rib cage. And she's going to rotate outwards, pressing hard, holding for 3 to 8 seconds. And then internal rotation, where she puts her arm on the other side, and she brings her arm towards her body, holding for 3 to 8 seconds.
For isotonic exercises, we're going to have the patient do all exercises 10 to 15 reps, maintaining shoulders away from the ears and shoulder blades lowered and towards the back. This will provide proper posture and reduce or avoid possible impingement. So we're going to start on our first exercise. The patient is going to do a banded front raise. So standing shoulder width apart onto the band, patient is going to raise his arms coming forward and then release backing down to starting position. Our next exercises are as an extension exercise, and we're going to have the patient stand against the wall, having head, arms, and hands against the wall. And the patient is going to have 90 degrees bent in the elbow, raising the arms above the head and back down to starting position. The patient's going to hold his arm straight out and rotate the arm down and inwards and then back again to starting position. It's going to start with standing shoulder width apart on the band with both arms firmly grasped on the band. The patient's going to raise the arms laterally outwards and then come back down to starting position, maintaining a slight bend in the elbow and doing this for 10 to 15 reps. And rotate outwards and then coming back to starting position. Okay, internal rotation is with the elbow also tight against the hip or close to the hip at 90 degrees. I'm going to rotate inwards and back out to starting position.
All right, so right now with Tyler, we're going to work on some scapular stabilization exercises. So first, we're going to work on some protraction exercises. So I'll have Tyler set up in a push-up position. And basically, he's going to depress and elevate the scapula, keeping his arms straight. And we'll do 10 reps of that. And then next exercise will be scapular retraction. So basically, we'll get a band. Tyler will hold it with his arms extended out at a desired width. And then he'll extend his arms out like so. 10 reps of that as well. Next exercise will be for scapular elevation. So we'll have Tyler lay on his stomach on the bench, have one arm on the ball, and basically just move it up and down. And then he'll rotate arms.
Okay, we're going to be focusing on some proprioceptive exercises. Proprioception helps you to recognize the movement and position of your body without visually seeing it. Proprioceptive exercises will allow you to build up stability and to be able to adapt to changes in your environment. So, Shayna is going to start off with an early progression where she is going to keep her hand on top of the exercise ball and she's just going to roll it forward as far as she can and then roll it back. Awesome. To progress this, we'll have her hold her shoulder at 90 degrees of flexion with a small ball underneath, and she's just going to roll that clockwise and counterclockwise. All right, for her final exercise, she's going to go on her hands and knees, and she's going to raise her unaffected arm up, and she's just going to repeat that. That's going to help her to stabilize her other shoulder. And then to progress this, she's going to keep doing that, but she's also going to raise her opposite leg at the same time.
So we're going to finish it off with a functional throwing exercise. So we're going to have Felix do some YTWs and some A's. So essentially what Felix is going to do, he's going to lay down prone on this bench. You can do this with dumbbells if you need to add resistance. You can also do this with bands, TRX. There's a lot of ways to do this exercise. So Felix's arms are going to be by his side. His shoulders are going to be back and arms by the side on the ground there. So he's essentially, with the thumbs up, he's going to raise his arms on a bit of an angle to make it Y. And then he's going to go back down while keeping those shoulder blades back. He's going to do that for 8 reps. Okay? Good. So the second one we're going to do is tees. So with the palms face down. Felix is going to squeeze his shoulder blades together and bring his arms out to his side. Perfect. Again, we do 8 reps. Then we're going to go to W's. So Felix is essentially he's going to essentially externally rotate. He's going to keep his arms at about 90 degrees. And then he's going to rotate his arms out, making a W with his body. So we're looking to have the forearms parallel with the ground. Okay, again, 8 reps. And then the last one he's going to do A's. So thumbs facing down, he's going to essentially, he's going to squeeze his lats, and his arms are going to come behind him at a bit of an angle to make an A. And he would do 8 reps of that.